Physical assessment. When you're gathering data for your physical assessment, that data collection is going to include interviewing the client, which will be a collection of subjective client data and a health history. You'll be doing a physical assessment and possibly even setting the client up for some diagnostic testing. As you're gathering that baseline data, you will support or refute the subjective data with your physical assessment. You will identify and confirm nursing diagnosis with your physical assessment. Additional things with your physical assessment will be making clinical decisions about a client's changing health status and management, and evaluating the outcome of care. Some considerations with the physical assessment, again, are to be aware of cultural sensitivities. You may need to provide some same gender staff. Always address the client formally unless the client gives you permission to call that client by their given name. Obtain data from the client whenever possible and from family or significant others when not possible. Assessment begins with the first client contact. I've told you before, you need to develop a routine, systematic approach to your assessment, and usually that is head to toe, to make certain that you do not leave anything out. You may have to alter your technique to accommodate the client's age. Physical assessment, again, is often able to be integrated with tasks. Any ADLs, bathing, toileting, medication administration, etc. You'll need to bone up on your therapeutic communication skills to be able to obtain a good interview from your client. Health history components include demographics. Where do they live? How old are they? What is their gender, their occupation, marital status, family at home? The chief concern. Why is the client seeking care in the client's words? History of a present illness. You need some details. Chronological description of the symptoms, severity, location, quality, quantity, etc. Past health history and current health status. Do they have any allergies? What surgeries have they had? Childhood illnesses, medications, what's their diet? Are they a smoker, or what is their alcohol intake? Family history. Health information of immediate relatives. Social history. What are their support systems, and what's their spiritual health? Health promotion behaviors, diet, exercise, safety equipment use. Then you begin to assess basic needs. There are several different ways to do this, but for example, use the mnemonic RN's HOPE. Getting ready for your examination requires some planning. Always provide the privacy and make sure that everything is ready to go. It's important to always inspect, palpate, percuss, and auscultate in that order, except when you're assessing the abdomen. When you're assessing the abdomen, it will be inspect, auscultate, percuss, palpate, because if you percuss or palpate prior to auscultating, you can alter vowel sounds. Inspection. You always look as you are assessing using all of your senses for touch, smell, sight, etc. And listen to what the client is saying. Is what the client saying matching what you are seeing? Palpation is actually touching the client to determine size, consistency, texture, temperature, location, and tenderness. Always remember that if they're complaining of pain, that is going to be the area that you will palpate last. If you palpate that area first, you may alter the client's ability to tell you if there is anything going on in that area, because it may increase pain in the area that they are actually hurting. Percussion can be done directly or indirectly. If it's direct, you're striking the body to elicit sounds. Indirect is what the picture is showing in your slide. You place the hand flat on the body and strike the hand rather than the body to elicit sounds, usually the middle finger. Or you can use the fist to assess for tenderness over the kidneys, liver, and gallbladder. With auscultation, again, you have to make certain that you eliminate extraneous noises so you can hear exactly what's going on. The stethoscope diaphragm, the large part of the stethoscope, is used to listen to high-pitched sounds. The stethoscope bell, the smaller part of the stethoscope, is used to listen to low-pitched sounds. This is a variety of examination positions. You need to have the patient positioned in the appropriate position for the type of examination that is going to be performed. With your general survey, again, you're going to be doing an overall picture, looking at gender, race, age, signs of distress, body type, their posture, their gait, their body movements, hygiene, grooming, how are they dressed, body odor, affect, mood, speech, signs of abuse and substance abuse. With their height and weight, assess trends in their body mass index and assess trends in any weight changes. With skin, you're looking at color, moisture, temperature, texture, turgor, vascularity or capillary refill, edema, wounds, lesions, etc. Anything out of the ordinary. With the hair and the scalp, what type of hair? Is it a normal color, distribution, thickness, texture? With the nails, you're looking at the color, not necessarily polish color, but you're looking at the color of the nails, texture, shape, length, ridges, wounds, presence of any fungus or infection. The upper left picture is a picture of assessment of pitting edema. The upper right is a basal cell carcinoma. The lower left is a malignant squamous cell carcinoma. And the lower right is a malignant melanoma. This is a way to assess irregularities in the skin. The upper left is a macule. Upper middle, papule. Upper right is a nodule. Middle left is a tumor. Middle center is a wheal. Middle right is a vesicle. Lower left is a pustule. Lower middle is an ulcer. And lower right is atrophy. If you look in your book, you can get the definitions for each one of those. In assessment of the head and neck, with the head, you want to encourage helmet use whenever appropriate. Headaches, neurological symptoms, the size of the head, the shape of the head, and the contour of the head. With the eyes, you look at the size, shape, structure, visual acuity, visual fields, conjunctiva, sclera, cornea, pupil, and iris. With the ears, you're looking at pain, discharge, hearing changes, auricles, ear canals and eardrums, and hearing acuity. With the nose and sinuses, discharge, obstructions, history of bleeding, snoring, and breathing difficulties. With the mouth, you're looking at the teeth, appetite changes, sores, tobacco use, lips, mucosa, gums, and the tongue. With the pharynx, you're looking at the uvula and checking lymphoid tissues. The neck, you're looking at the muscles, movement and strength, the lymph nodes, size and tenderness, the carotid arteries, listening for bruits, the thyroid gland, the position of the trachea, and any pain. With the thorax and the lungs, of course, you're going to be auscultating the lung sounds. You're listening for vesicular, bronchovesicular, vesicular, bronchovesicular, bronchial, crackles, bronchi, wheezes, pleural friction rub, fremitus. You're going to listen over the trachea, the upper chest, anterior and posterior. If you do not know what fremitus is, it's basically having the patient talk and listening for the vibrations by placing your hand on their chest or their back. Heart and vascular system. When you're comparing, determine again, are pulses equal? Are the rates equal? And then you grade the pulses. Heart sounds, you're listening for S1 and S2, which are normal. You're listening for murmurs, rubs, thrills, and S3 and S4, which are abnormal. The point of maximum impulse is going to be your PMI, and that's the place where the apical pulse is most easily palpated. With the breasts, make sure that you assess in both males and females. They need to be taught self-examination techniques. Make sure that the breast is divided into 4 quadrants and a tail. You will assess for pain, lumps, areola color, nipple discharge, dimpling, symmetry with the arms down, over the head, and hands on the hip. The entire breast should be palpated, including up to and including the axilla. And in your resources is a self-breast exam and a testicular exam. In the abdomen, you should have the client draw their knees up slightly during the assessment. Palpate for any masses or underlying structures, the liver, stomach, uterus, ovaries, kidney, and bladder. Assess all sounds in all 4 quadrants for at least a minute in each quadrant, 5 minutes if no sounds are heard. I know this is a little different than what we told you in clinicals. This is what your book is telling you. So go with this time frame rather than what is listed in clinicals. Make sure that any suction devices are turned off, such as an NG tube suction. Normoactive bowel sounds will be 5 to 35 sounds per minute. And then you also have hypoactive, hyperactive absent. With genitalia, anus, and rectum, you don't always assess these areas unless there is a specific complaint. It is necessary to assess menarche and obstetrical history, sexually transmitted infections, internal and external organs, pain, lumps, discharge, urinary flow and/or difficulties, unusual bleeding, and have the testes descended. We also take this time to provide some education with pap smears, birth control, and sexually transmitted infection protection. Musculoskeletal. You want to look at everything, including their gait, how they move, etc. These pictures show abnormal curvatures of the spine. You have lordosis, which is a sway back. They have an increased lumbar curve. Kyphosis is the hunchback or the exaggerated posterior curve of the thoracic spine. And scoliosis, which is the lateral spinal curve. In other words, it curves to the side instead of straight back. And neurological. You want to assess mental and emotional state. Box 3030 has a mini mental state examination in your book. Level of consciousness. You can do Glasgow Coma Scale. Their eyes are open, best verbal response, best motor response, all of those are scored. Intellectual function, memory, long-term and short-term. You can do cranial nerve function. That's on table 3038 in your book. Check sensory function, numbness, tingling, sensations that are felt symmetrically. Motor function, coordination, and reflexes. 0 is no response. 1+ is sluggish or diminished. 2+ is active or expected. 3+ is slightly hyperactive. 4+ is brisk, hyperactive, with an intermittent or transient clonus, which clonus is repetitive contractions and relaxations of the muscles. And then you need to determine if they're symmetrical. You will not do a complete full physical examination with every patient, but this shows you how to assess an area more in depth than what we have been doing if someone complains of problems with musculoskeletal or neurological, etc. It just gives you an idea how to do a more in-depth examination.